Good evening. I'm Dr. Lou Graham, the founder of Catapult Education. Catapult Education has spent the past 20 years evaluating dental products and technologies and assessing their potential for success in the dental marketplace. To create our own Catapult Crown investment platform, we've taken this past 20 years of experience and partnered with a leading group of financial investors who've invested in many startups with great success. To ensure full compliance with SEC requirements, along with other legal matters regarding investing, we continue to work with the firm Lowenstein and Sandler. For our administrative services, we utilize Carta, which you will see on our platform at www.catapultcrown.com. And finally, our auditing services are performed by Eisner and Amper. The most important part of what we do is our due diligence. The clinical team we've put together includes our Catapult speakers, evaluators, along with a variety of industry dental experts in a variety of specialty areas. Together, we do the clinical assessment. Our financial team carefully evaluates the financial projections and other essential business criteria. Finally, we have a legal team that investigates the intellectual property and all the other legal aspects to ensure we are protected as much as possible on each and every investment. Together, this due diligence process takes months to complete. The end result, only a small percentage of companies will appear on our platform, and 3 of those companies you will meet tonight. These companies include Magdent, and their information will be presented by its CEO, Benny Barrick, along with Dr. Jamil Shibli, an advisor, OYM and its Chief Growth and Marketing Officer, Greg Barnston, and we will be led tonight with Cloud Dentistry's CEO and a presentation from Trey Tempachin. Each presentation will be roughly 15 minutes, and there'll be a Q&A immediately thereafter. You can type your questions into the Q&A, and I'll be happy to share those questions to the group after each company is presented. Catapult Crown will then be hosting follow-up Zoom meetings for all of you with each company over the next 2 weeks. We will show QR codes for each company's times, and you can snap a quick picture of each QR code, and it will obviously translate into the information regarding each presentation. We'll also follow up with you with some emails afterwards. In these Zooms, we'll see their executive teams, and they'll be sharing far more detailed information. And each meeting, as we've had other Zoom meetings with other previous companies, will be very interactive. This will allow each of you a deeper dive into each company, and you'll want to pursue and learn much more about. With that said, it's time I present. Let's see your face, Trey, the CEO of Cloud Dentistry, really great guy. I'm going to let you unmute, and I'll let you share your screen, and I will take my face away. Trey, if you take it over.
Thank you, Dr. Graham. Really appreciate the warm introduction, and thank you, Catapult Crown, for hosting us tonight, and thank you to all the attendees for making time for us this evening. I really appreciate it. As Dr. Graham said, my name is Trey Tempachin. I'm the CEO and co-founder of Cloud Dentistry. Cloud Dentistry is a web and app-based marketplace for finding on-demand temp or permanent hires in the dental staffing space. I didn't ever realize I was going to end up in the dental space. I was actually a lawyer by trade. So I graduated from Harvard Law School and practiced as an attorney for 8 years. So don't hold that against me for those of you that have had bad experiences with lawyers. I'm reformed though, so now I'm in the dental space, and it started with a dinner conversation that I was having with an old high school friend of mine. This was a number of years ago, and we were just catching up over dinner. I hadn't seen him in probably 10 years. His name is Reza. He was a high school friend, and Reza is a dentist. And so Reza and I get into this kind of friendly chest bumping match, arguing about who had a tougher job. Was it tougher being a lawyer or tougher being a dentist? And I was confident that it was tougher being a lawyer, but by the end of the conversation, we started a whole business around his pain points. So I think he won the discussion. He tells me, look, Trey, that as a dentist, that he was in patients' mouths for the better part of the day. On top of it, he still had to run a business. And then to add insult to injury, the staff was very unreliable. And this is because of the demographics of the dental professional industry. Over 50% of dental professionals are part-time or temporary workers. And so I didn't really believe Reza at the time. So I remember taking out my phone over this dinner conversation and looking it up on the Bureau of Labor Statistics that, indeed, about 50% of the dental professionals are part-time or temporary workers. And so I asked him, what are you using to find staff right now? And as an outsider to the dental industry, it was a little bit frightening because he told me he was using Craigslist, Indeed, and temp agencies. And so I'm guessing that you guys are all pretty familiar with, job boards and staffing agencies. And I'll kind of go to my slides so we have some data on them. So, with job boards and staffing agencies, it's just very time consuming and very expensive to use those kind of outdated modes of finding dental professionals. With job boards, the critique I often hear is that it's often like feeling like sending messages into a black hole, a lot of stale resumes, very low response rate. It's about recruiters say that they get responses from candidates about 15% of the time. So it's a very low response rate. And then if you actually find someone through a job board or through Facebook and you actually book them for a working interview, the odds of them actually showing up to the interview are very low. And I don't know if it's like a generational thing or what, but we polled our offices and they said that when they look for candidates on those platforms, that about 40% of the time that they have a booked working interview with them, the candidate not only no-shows, but they actually just ghost the office. So I'm not sure how many of you here in the audience have ever been ghosted by someone, but it's just like, come on, at least give me a call and make up a story about how your car broke down, save some face or something, but they just don't show up and then they just disappear. You can't get in contact with them. They don't call you, just nothing. That happens about 40% of the time. So it's a very time-consuming process, very unreliable process. And then on the other end of the spectrum, we have, the temp agencies, the job, the staffing agencies. It's a very traditional model that relies very heavily on human capital to make the matches happen. And because of that, they're very expensive. And so they usually charge anywhere from 25 to 30% markups on the daily rates for the professionals that they place with the dental office. And then if a dental office loves working with a professional that they find through an agency, there's almost always a buyout fee to the tune of $10,000 or more. So it's just very, very cost prohibitive. So it's kind of against this backdrop that the wheels in my head start turning over this dinner conversation with my friend Reza. And so I tell him, Reza, like, this is insane. Like, this is the era of the sharing economy. There's no way there's not a better solution for this. If I needed someone to walk a dog, I could download the WAG app. If I needed someone to deliver food to me, I use Instacart. For groceries, I mean, there's sharing economy apps out there for pretty much everything, but there wasn't one in the dental space. And so that was kind of the birth of this idea to create a marketplace that just disintermediates the entire process, puts the power back in the hands of the end users, reduces costs, speeds up the process, and increases the quality of the dental professionals that are being placed with offices. Timing is everything. Right now, the ADA did a poll of dental offices, and they've confirmed that this is the #1 pain point in dentistry right now. Of the dentists that were polled, over 90% said that it was either extremely challenging or very challenging to find a dental hygienist in particular. Dental hygienists are just almost impossible to find according to dental offices polled by the ADA. So it's a very acute pain point post-COVID. Now, why is that? Why is it such a difficult thing for dentists right now to find staff? And this problem predates COVID, but it's become even worse as a result of COVID. And so it was kind of a perfect storm in the dental industry. Over about 1 in 5 healthcare workers quit, didn't come back, and the female workforce participation rate is at a 33-year low. And the dental industry is comprised primarily of women. 98% of dental hygienists are female. And so it's kind of that perfect 1-2 punch that really just constricted the labor supply more than it was already constricted before COVID, which put us in the perfect, put us in the exact right spot at the exact right time with a platform like Cloud Dentistry to be able to help people overcome this growing challenge. We also have demographics working in our favor. So if you look at different age cohorts, you can see that the more senior generations don't favor part-time and temporary work nearly as much as the younger generation. When you get to the younger generation, it's over 50%. So all of those forces combined are what led us to, really develop this platform and try to push it out to the dental professionals and the dental offices so that they could have an easy turnkey solution for this, growing very, very acute problem that they're facing right now. And so, like I said at the beginning of the call, Cloud Dentistry takes a marketplace approach to disintermediating the staffing industry and putting the power back in the hands of the end users to make these connections happen in real time. So I'll show you a demo of the platform in a second, but high level, it's a freemium to premium model. So the offices can create a free account with us. They can look at all of our inventory for free. When they decide that they want to book or message professionals, that's when they hit a paywall and they're prompted to upgrade to a paid subscription. So we're primarily a SaaS-based model, which is that nice recurring revenue stream from the dental offices. On the professional side, it's completely free for them. That's one of our strongest messaging points to them and why we are so good at getting the professionals onto the platform is we tell them, look, guys, for the longest time, you've been saddled with these large agency fees, these big buyout fees. This is money that you should be empowered to make on your own. You shouldn't have to be giving money to a temp agency. And so everything that the professionals make on the platform goes 100% to their wallet. They set their own rate. They set how far they want to travel. They set when they want to work. And then there's no buyout fees. So when they find an office that they love working with, we're happy for them. We're not going to stand in the middle of that and police our users. We're happy for the office. We're happy for the professionals. We don't charge any additional placement fees. I'll show you a quick demo of the platform because I think that's when it really comes to life. Give me 1 second here. Okay. So now you're looking at a live version of the platform as you would see it through the eyes of an office in Houston, Texas. So none of this is mocked up for demo purposes. These are all real users, all real data. And I want to kind of walk you through the process of booking a professional because it just highlights just how turnkey and how easy this is. So if you're an office, this is kind of all part of your freemium account. You go to the Find Professionals. I'll do hygienists because that's the one that 90% of dentists say they can't find. And then you're immediately shown a list of all of the hygienists that are ready to work in your area right now. Everyone that you see here has already had their license verified. They have already specified how far they're willing to travel. So you're only going to see them if your office falls within their travel radius. So you know that they're willing to travel to your office. They've set their rate and they set their live schedules for you. So you can basically just peruse the talent at your leisure, again, at no charge. So literally the barriers to entry are now zero. We've removed all barriers to entry. Offices can look at this database for free. It's not like Indeed where you have to pay money up front to spin the wheel of chance on the resumes. You can see all the candidates that we have, and we have thousands and thousands of them. Once you're ready to work with someone, you can click into their profile. We can read more about Tiffany. You can see that she's had 78 bookings, 0 no-shows. So that's a very important point about the platform is that because of the analytics and because of the accountability that we bring to the table, unlike the 40% no-show rate that offices experience when they work, when they find people through Facebook or a job board, on our site is less than 1% for the hygienist. So you can see that we have great metrics around that. You can read her bio, you can read her skills, you can read what other offices have said about her before booking her. So again, you're not flying blind. These are all offices that have had verified bookings with Tiffany. And then when you're ready to work with Tiffany, you can book her using her live schedule. You click on one of these open time slots. This is when you would hit a paywall normally. You'd be prompted to upgrade to a paid subscription. You pick a start and end time based on her availability. And then you click send request. I won't actually click it because, like I said, it is a live platform right now. And so Tiffany would be wondering why I had booked her for a work assignment. But that's kind of how quick and easy it is to book. So you can see that what used to take hours now takes a matter of minutes. So it's just a lot quicker. We went on speed, hands down. On price, the subscription service is $90 per month on average per location. So we're orders of magnitude less expensive than the tens of thousands of dollars that agencies would be charging. So we went on price. We went on speed, hands down, and then quality, we went on that as well. So because it's a peer-reviewed site, all of these professionals tend to show up and do very good work because this online real estate is very valuable to them, and they don't want to get dinged on their reviews. So over 95% are ranked 4 out of 5 stars or better. We also have the lowest no-show rate in the industry. You can see it was 0 no-shows, candidate after candidate after candidate. The last thing I'll point out on this demo is that we've heavily gamified the platform. So if I were to sort by last login, you can see how we reward users for responding to messages quickly, for responding to booking requests quickly, for getting good reviews. The entire platform is heavily gamified, and they have very strong incentives to behave well and to respond to the offices. When they're pinged by offices, our average response rate is less than 20 minutes to get a confirmed booking, so it's very quick. And you can see here the numbers kind of back it up. You can see that Jennifer's last login was less than 1 minute ago. Diana, less than a minute ago. And mind you, these are hygienists that 90% of dentists say it's impossible to find. And here we are at 7:30 Central Time PM. And these users are logging in within minutes of each other on the platform. John was 2 minutes ago, Amy 6 minutes ago. We just got to keep scrolling like this for a long time. You can see we have thousands and thousands of professionals that have logged in within minutes of us having this call tonight. These are all hygienists that dentists say they cannot find. And here we have an abundance of them ready to work on a moment's notice. So I'll stop screen sharing there. That's the platform in a nutshell. I'm going to go back to my PowerPoint presentation to talk about some of the business KPIs. So we covered that already. We went on price, speed, and quality, like I mentioned, for the offices. And for the professionals, they're earning more money. They feel more empowered than ever. They made over $50 million in additional income by working through Cloud Dentistry to date. And it's all on their terms. So the professionals themselves have been very galvanized to this cause. This was covered as well during the demo. It's a freemium to premium model, primarily SaaS-based. We do have a small transactional upsell. So offices want us to process the payments on their behalf to these professionals. That's kind of an issue, the 1099 forms at the end of the year. So we're the ones that face off vis-a-vis the IRS. That's an upsell, and we charge on a per booking, a flat administrative fee on a per booking basis. So that's another way of monetizing the platform. But most of our revenue is the SaaS model. So here are some of kind of our core business KPIs. This was from February, so it's already slightly outdated because we're growing so quickly. So here it says we have 3,300 paying accounts subscribed right now. Right now we're closer to 3,500 paying accounts. Monthly revenue of 350,000 as of February. Again, it's dated, so now we're at about 390K per month in monthly revenue. We're seeing on average 100% year-over-year growth, so we're growing in leaps and bounds. And our current revenue run rate is about 4.4 million at this point. We have about 40,000 unique visits per week. In terms of bookings, we're doing 10,000 placements every single month. So, product market fit is there, utilization rates are great, and people are paying for the product. We've also proved that we're able to scale it. And so, a lot of people can launch small businesses in their backyard where they know friends and family and know some dentists. We managed to scale it to a number of different metro areas. So we're very strong all through Texas, Houston, Dallas, Austin, San Antonio. Denver is another very strong market of ours. Atlanta, Chicago, Phoenix, a lot of Florida, pushing into LA, New York, DC, and Boston. So kind of very robust launch strategy and great success metrics. If you look at Houston, 1 out of every 3 dental offices is currently subscribed to Cloud Dentistry, and there are basically no more staffing agencies there. Same story for Dallas. We basically just putting everyone out of business with this model. The go-to-market strategy is critical. Again, we're all about removing the friction to getting people onto the platform. So offices can create a free account with us, like I mentioned, and our sales cycle is incredibly short because of that. The UI UX is so enticing, so appealing once they can see all those users that are ready to work at a moment's notice, that of the offices that create a freemium account with us and upgrade to a paid subscription, 50% do so in the very first day of creating their freemium account, and 80% within the first week. So our sales cycle is almost non-existent. We also have a very robust ambassador program. So all of the dental hygienists, all of the dental assistants that create accounts with us, they love Cloud Dentistry, they love what we've done for them, and then they can earn additional money, $100 a pop for every friend that they refer to the platform. So we have kind of this very short sales cycle coupled with a very viral product that once it's in the hands of the dental professionals, they're able to market it to great effect for us. We also do all the standard things like, the continuing education events. We have a CE, the ability to host CEs on our site, and with Catapult, we'll be really leaning into that as well. We do digital AdWords, Facebook advertising, you name it, we do it. We even have a scholarship fund, a $25,000 scholarship fund with the dental schools, so they will send us their students upon graduation. Here's a quick competitive landscape. I think I've made a lot of the differentiators apparent at this point between, job boards like Dental Post or what I would classify as temp agencies with an online veneer. That would be like OnDiem, Stint. They still use the temp agency model, but they have an online wrapper around it to make it seem a little bit more appealing to the offices, but ultimately they're still charging 25% markups on the daily rates, big buyout fees for the staff. And so it's just not a very, they haven't truly innovated. In my view, if you've innovated, you should be able to fundamentally change the business model in favor of the end users. Here's a quick overview of our team. For those of you that want to schedule a follow-up, I'd be happy to introduce you to members of our executive team in person. I won't spend too much time on this, except to note that our head of product is really one of the best in class. He was formerly the head of product for Lycos. He was also head of product for Quantia MD, which is an educational platform in the healthcare space. And so he has a massive amount of experience building these kind of fabulous UI UXs and really being a product-driven growth engine rather than having to spend all your money on just sales and marketing to achieve the growth you want. So, with that, I'll turn very quickly to, what our exit strategy is. SaaS companies, if you look SaaS companies up online and look at their valuations, they've taken a little bit of a dip. So historically, they've been trading at 15x of top line revenues. Now they're down to about 8x, which is where Cloud Dentistry is priced for the current round. So we just price it right at the average of what the industry is trading at right now for SaaS companies. Arguably, I would say that we should trade higher than that because there's a lot of kind of very doggish companies in this down economy that comprise that kind of SaaS cohort that makes up the 8x multiplier that bring down the average, whereas Cloud Dentistry is one of the companies that does particularly well in this type of environment. We are not I wouldn't say we're counter-cyclical, but we perform very well during volatile times because people need the staff and they have nowhere else to go. And so we've done exceedingly well. And we also have the marketplace component to the SaaS. We're not just a pure SaaS play. That's another very important thing to note and remember is that it's a very sticky product, right? So once you get all these users into the system, all these hygienists, all of these assistants that have spent time and effort building out a robust profile and have earned reviews on the site, and now have valuable real estate that they can then market and use to make additional money, that's very sticky. It creates a very powerful moat around our business to competition. If a competitor comes in and tries to peel away our supply, we own the supply, especially in the markets where we're dominant. And so that extra marketplace component makes us even more powerful and more appealing than your traditional SaaS companies, where for your traditional SaaS company, we could hire a bunch of engineers and copy someone's software and try to go to market. And so with Cloud Dentistry, you don't have that worry. We have a very defensible business model. So the goal with this company is, let's raise this money, keep growing the company at this very aggressive growth rate that we have, and then have a fantastic exit. Once we hit, 10, 20,000 offices subscribed on the platform, we can easily 10x from where we are today in terms of valuation. So that's my pitch. I really appreciate your time tonight, and I look forward to answering your questions during the Q&A. And thank you again for your time and your consideration. Take care. Lou, am I handing it back over to you?
I'm going to absolutely invite Benny. It's showtime. Why don't you show your face and we'll go from there.
Hello, everyone. Nice meeting you all. I have with me Professor Jamil Shibli. He's the head of oral implantology from the Guadalupe University from Sao Paulo. And I'm happy to present you with Magdent. About myself, I'm an ex-corporate lawyer, had some experience in consulting. And for the past 2 years before joining Magdent, I did around $1 billion of transactions of real estate in the US. And Magdent was established because my father, Professor Shlomo Barak, which is a dentist, had a patient that suffered from cancer. And after 3 failed implants, he thought, well, let's try something else. So after reading about pulsed electromagnetic field technology and what it does for the orthopedic industry, allowing bone growth stimulation, he sent her to the orthopedic clinic. And after 6 weeks, she came back to his clinic, and then he saw that the implant was successfully integrated. So what we were doing now, and past, I would say, starting for 2011, was using the technology and bringing it for the first time for the dental field. Can you see my screen?
Yes.
Okay. So Magdent using electromagnetic field technology. Again, sorry for that. Okay. So as you all know, there are 3 main problems for the in the dental implantation field. The one is a long healing period, which usually takes between 3 to 6 months for a full also integration. There's a high failure risk for high-risk patients, mostly patients that suffer from diabetes, heavy smokers, patients that suffer from osteoporosis, patients with cancer, and also the holy grail is really periimplantitis, which is the inflammation that appears around the implant in approximately 43% of the cases, and eventually cause the implant to fail. Pulsed electromagnetic field as being technology that was approved by the FDA since 1979. So we didn't invent anything. The technology is approved, is being operated since then in orthopedic use. There are multiple, articles, case studies about this technology. And what we did was to miniaturize it. I'll show you a quick video. So as you can see here, as I mentioned, exactly the same shape that you're using today in your clinics. Okay, wonderful. Okay, just a second. Okay, so as you saw, we have exactly the same shape of the button that you're using today. Dentists don't have any learning curve using the same protocols. And it's made of titanium, which is similar to, or exactly the same type of titanium that you're using today. And what we do is that we currently have 17 different models that fits today with 15 brands. And we have in our lab the ability to add additional brands to our portfolio of products. And we believe that it can be compatible with up to 85% of the implants around the world today. And I'll show you exactly how we activate it. But once we're activating the product, it works for 30 consecutive days. So what we're selling is these packages of 10. Okay. It comes as a 10 pack. Inside you have 10 meds. Okay. Looks like this. And we are activating each one of those of meds by using the activator. So dentist needs to have one of those in their clinics. And once you're taking out this from the box, they just need to press here. Can you see the blue light? Now our product is fully operational and it works for 30 consecutive days. The only thing you need to do is take this out and screw that on top of the implants, the different implants that you're using. We have in our website our compatibility list. And of course, if distributors would like to start distribute our product in specific countries where we don't have the current distribution agreements, and we have the ability to do this reverse engineering process and start distribute that in with additional implant companies. Okay, so the technology, as I said, is is really proven. We have Magdent have strong, significant backing, and we've published 5 articles until today in peer-reviewed journals, and in progress we have 5 more articles about osseointegration, peri-implantitis, and keratinized gingiva. I'll let Professor Jamil Shibli to add his color about the technology, and I will continue with the commercialized part. Please, Jamil.
Yes. Hello, everyone. Thanks, Benny, for the introduction. The most interesting thing about the meds, the Magdent device, is that they play a pivotal role not only to increase the bone to implant contact, to increase the density around the bone, but also to influence and to impact against the peri-implantitis disease. Peri-implantitis is a birth disease that can suffer more than 35 to 40% of the implant. If we can imagine that 5 million implants are selling in the US and 3 million implants are selling in Brazil, if we're talking about 20% of the prevalence of peri-implantitis, we are talking about 1.5 million diseased implants. This is a very bad business for us, not only for the companies, but also from the surgeons. That's why Magdent are working on that. If you can see here is the histology, I don't want to bore you with that, but the idea is like the principle of the proof that the meds, as you can see in your left side of your screen, that the control side against your right side, when you have the activate Magdent, we have more blue dots. That means that you have more vascular endothelial growth factor. That this increase the vascularization around the tissue. Here, I would like to do a parenthesis that we must remember that the peri-implant soft tissue is completely different from the gingiva, the periodontal tissue, when we have more cells and less fibers. And when we are talking about peri-implant tissues, we have more fibers and less cells. That's why we are able to populate more than. The next one, as you can see, that at the same time, we have more vascular endothelial growth factor that help with the vascularization of the tissue. We are against the anti-inflammatory, the pro-inflammatory activities like that tumor necrosis factor, that it's a cytokine that are implicated with several inflammatory diseases, including peri-implantitis. As you can see in your left side, we have more blue dots. That means this is immunohistochemistry. This is from human samples, human gingiva that we took after 60 days from the patient that used the Magdent treating peri-implantitis. As you can see, we have more in the control side, is inactivated Magdent against the activated Magdent. There is a clear area, as you can see. And when we follow in this rationality, the next slide, we are able to see how the pools are able to increase also the primary and secondary stability. As you can see, this is a human clinical trial published in materials 3 years ago. As you can see that we increase 13% implant stability against the control group. And not least, we also have 15% of difference in raise and tumoral nexus factor after 4 weeks implantation, as you can see before. The next slide is also important, as you can see that we increase the primary stability, we increase the bone densities. This is a preclinical study. Actually, this was the first paper published by Magdent. This paper was published by the first author, Professor Shlomo Barak, and you can see that Magdent increased for almost 50% of bone-to-implant contact and decreased almost 32% the trabecular spacing, that the empty space around the bone. And if you take all together that we are able to increase the bone density, including an inflammatory condition, reduce the number of pro-inflammatory cytokine, increase the vascular endothelial growth factor, we are able to provide a nice microenvironment for this growing. And this is an ongoing study performed by Rambam in Tel Aviv. Then they use to treat periimplantite cases. We have two lines to treat periimplantites, surgical and non-surgical therapy. Using Magdent, you can use non-surgical therapy to increase the potential to debridement, including mechanical debridement, to reduce the number of pathogenic species. The idea is that the Magdent works as the antibiotics. When you give antibiotics, both local or systemic way for your patient, we are trying to change this climax community and shift this microbiota from the bad guys to the nice guys. And when you use, instead to use antibiotics, you can use the med. As you can see, this is a short-term report. After 3 months, we have less marginal bone loss than the control group. And also, recent papers published by group from Frank Schwartz from Germany, Hayal from Israel, some guys from Harvard University, Lorenzo Tavelli, from Hawley Wang from Michigan, are showing that keratinized tissue is very important to keep the long-term survival success of dental implants in the clinical way. And what you can see in our preliminary data, that the Magdent are able to better organize the keratinized tissue surrounding the peri-implant tissues when you activate the med against on the control side in your left way, that we have something a little bit disorganized on that. We are trying to prove that the Magdent are able to increase the gingival thickness. And maybe, we are not sure about that because it's only preliminary data, modify the gingival phenotype on that. This is really a new paradigm to use all those devices. And here you can see in a close contact that after we remove this soft tissue, this biopsy, in your left side, when you have the blue arrow, you can see the adhesion of the soft tissue. It's so strong that sometimes are not able to detach the titanium in the activated Magdent. And in addition, we also have an increase of thickness of this surface. And at the same time, we have less bacteria, as you can see here in your right side in this yellow circle. That means at the end, we have a nice environment to grow new bone, a nice environment to increase all this activation. Against, we have a reduction of the periodontal pathogenic biofilm, and you can decrease the number of the pathogenic bacteria and decrease the number of the peri-implantitis disease, and also try to reduce all the pro-inflammatory cytokines surrounding that. That means we have a complete activation of the Magdent in the both sides of the dental implants. In the right side, when you can increase the bone density, and the other side, you can decrease the number of peri-implantitis. This all together is, as we can see here, the future of implantology now. We are not talking about a development device or something. We already has this on the market. Benny?
Yeah. Thank you, Jamil. So as Professor Shibli mentioned, so what the med is doing is that we're allowing the acceleration of the healing process by 3 times faster. So patients don't have to wait 4 to 6 months. After 1 to 2 months, we have a full osseointegration. And in addition to that, we increase the bone to implant contact by 48%, trabecular bone volume density by 62%. And as Professor Shibli said, that's really the first real treatment for peri-implantitis. And Magdent has a CE mark. We have sales in specific locations currently in Europe, in Portugal, Spain, Russia, Romania, and we're now in the process of getting the FDA. We've done a pre-submission and have clinical protocols ready, and hopefully in 1 year from today, we will be able to finish up the FDA and launching our product in the US market. We are selling each med, each one of those small smart healing abutments at $45 per one for distributors and $170 each activator. And if you're a dentist, what it brings your place. So higher success rate with high-risk patients, and the quality of care is significantly higher. And you don't have to invest, buying our activator at $170. And by investing so little, money, you are in the trend of the technology. And of course, you're increasing your revenues by charging a bit more for this premium treatment. So in the next 24 months, we're going to increase and scale up our sales in countries that support the CE mark, continue the collaboration that we have with leading distributors, finish up with the FDA process, and completing and enhancing the keratinized gingiva and peri-implantitis researches. We're raising $4 million through Catapult investment platform, one more through Our Crowd. Our Crowd is the #1 and most active Israeli VC. Magdent is the first ever dental investment that Our Crowd is launching on their platform. I can say that one of our investors is the owners or the ex-owners of Tettenauer Auto Clubs. And, roughly that's the budget that we're planning. And we're basing this round on a very, very cheap price of $12 million pre-money valuation. Of course, our current investors will also invest in this round. And I can run this quickly. We have funded in 2011. We currently have 7 employees, but we're working with more than 40 tier 1 freelancers. Raised $5.2 million until today, and we have 17 patents that protect this unique technology. And that's part of the team that we have. Professor Shlomo Barak, which is the founder, Ran Tottenauer as a board advisor, and also Jamil and Ophir Pomovich. And that's it. Thank you very much for this opportunity, presenting with our Magdent technology. And we are pitching for investors on April 4th at 7 o'clock and 9 o'clock Eastern time for further information. Thank you.
Thank you. Thank you, Benny. Thank you, Jamel. Okay, Greg, or I'm going to hand it over to you.
All right. Thank you, Dr. Graham. Good evening, everyone. As he mentioned, my name is Greg Barnson, and I'm excited to be with you tonight to share what I believe will be the next breakthrough in oral care. I have quite a long history and lineage when it comes to oral care. My mom was a dental hygienist. I had one uncle who was an orthodontist and another that was a dentist. And I have a cousin who's currently running a startup. Of course, none of those family members make me qualified to be a part of a startup or the next breakthrough in oral care, but the 14 years that I spent at Procter & Gamble working on brands like Crest and Oral-B do indeed. And I'm so excited to take you through what we've got on our hands here, and I think you'll be really excited about it as well. As you all know better than anybody, there's a huge problem that still exists today. Tartar is a significant problem that leads to bad breath, unaesthetic appearance, and ultimately periodontal disease. And that's what leads to tooth loss globally, which is a massive problem. Existing solutions for tartar are really not working. There are products that are out there that try to prevent tartar from accumulating. Those don't work all that well, and they certainly don't remove it. Professional cleaning can be both inconvenient and painful for the patient. And in developing markets, the cost of the removal is just too high for most people. That's why we're so excited to share with you that we have created the first and only tartar remove technology that removes it in both humans and pets. It's a totally novel and new chemistry that has unique structures and strong potency. And we've proven that it's both safe and effective. You can see in the pictures on the right, the one in the middle is a tooth that's soaking in our solution. And you can see the tartar has just fallen off and at the bottom of that tube. In between that and the picture on the right, you see a before and after picture of a tooth that was soaked in our solution. And you can see A is the before and B is the after. The tartar's been removed. And then now I'm going to play a video which has a person applying professional gel to a tooth via that cotton swab, and you'll see what happens. So you can see the tartar flaking off with a fingernail after the professional gel has been applied. So incredibly impressive. As I mentioned, we've proven the safety of this by using world-renowned labs, including Envigo, Matic, and Intertech, done testing on the toxicity, on the irritation of the epi-oral human tissues and viability of the cells, as well as the enamel erosion and the surface micro-hardness. And when we did that, we had benchmarks, and one of those benchmarks was my former brand, Crest Toothpaste, and I'm excited and proud to share that our product proved to be even better than Crest. We have very broad patent protection, and we know that our technologies are patentable. We've already received feedback from the European Patent Authority. We have a pending international application, and we know that it's incredibly broad so that no one will be able to copy this. We also know that FDA approval is not needed. And that's because in the United States, tartar is defined as a cosmetic concern, which means the claims are ultimately not regulated by the FDA. And we already have safety testing to show that our product is indeed safe and effective, and we have plans to go above and beyond to do additional safety and efficacy testing. So the net takeaway here is that there's no additional regulatory work that's required to go after the professional market, consumer market, and ultimately licensing our technology to the big strategic oral care companies. We have an incredibly competent and successful team behind this. I'll be joined for the Q&A by our CEO, Or Lapid, who is a lawyer and entrepreneur, and Dr. Jordan Goldstein, who is our Chief Technology Officer, both a dentist and a microbiologist. And as I mentioned, spent 14 years with Procter & Gamble on brands like Crest and Oral-B. We have a very robust product pipeline planned, going after a total addressable market of $21 billion in the US and $45 billion globally. So you can see here, we plan to launch as many products as we can because we believe that our technology can ultimately change the world for the better. And to do that, we don't want to change consumers' oral care habits. We want to give them the products that they're using today. And so that's why we will create toothpaste, mouthwash, strips, denture cleansers, and down the road, we're looking at confections and chewing gum. We also plan to launch a professional gel, and you saw that professional gel in action via that video that I showed you. And then finally, we'll enter the pet market after we successfully move into the human market. The first phase of our launch plan includes launching in the United States through dental offices, direct to consumer, and then licensing our technology to big companies like Procter & Gamble, Colgate-Palmolive, GlaxoSmithKline, and Unilever. From there, we'll expand geographically, plan to patent our technology in 10 different countries. We'll launch our product in the retail market as well. And then I mentioned our plans to get into pet and gum as well. So how does it work for the professional channel or for the dental channel? Well, imagine the patient that walks into the office, sits in the chair, and the first thing that will happen is the hygienist will place our product in the patient's mouth with a tray. So the tray will be filled with our product, which is a gel, and they'll sit in a chair for about 3 minutes and then simply rinse the tartar away. So we know that this will be an incredibly quick treatment that results in a shorter overall treatment time and improves the office's profitability. And for the patient, it's a much less painful experience. So they'll enjoy, of course, coming to the dentist and the hygienist even more. After the patient completes all of their necessary prophy treatments, whether it be polishing or desensitization or whitening, the hygienist will give the patient a bag, and in that bag, of course, includes all the typical goodies, but it will also include a QR code, which allows the patient to buy an at-home product from us via direct-to-consumer site. We know that launching in offices will be very successful. And that's because the overall cost of acquisition and the number of dentists that we have to reach is not that big for this to become a meaningful business quickly. I think back to my days on the Crest business, we knew how important it was to win the heart and mind of the professional. And so we invested to do that. Sensodyne does the same thing, Invisalign does the same thing. we're going to do the same thing. And if we can just reach 1%, so if you look at the table on the right, if we would just convert 1% of dental offices, we already have a $20 million business on our hands. I talked a little bit about licensing. So we plan to create a name for our technology. And the analogy that I like to use is if you think back to the early days of the computer, personal computer, Intel did a very good job of licensing their brand and name across multiple different manufacturers of computers. And so you saw that Intel Inside sticker. And even to this day, you probably have an Intel sticker on your computer if you have a personal computer. Similarly, we'll create a name for our technology and we'll go to Crest and Colgate and Sensodyne and others, and we will ask them to license our name as well as our technology. And so they'll pay us for both the name and the technology. And we expect this to be a really big part of our business model going forward. This is our overall financial model. You can see by 2028, we plan to have a business that's over $200 million in revenue, over $100 million in gross profit, which leads to EBITDA of over 75 million. So if you do a 10x valuation on that 2028 number, you're looking at almost a unicorn, which is a startup with over $1 billion valuation. We're planning to launch next year, 2024. So we'll finish producing our products. And I mentioned the products previously. We'll file in countries that I mentioned as well, conduct additional safety and stability testing so that when we go to license with these big strategic companies, we have all the data and the science that we need to convince them this is very compelling. And we expect to hit a $10 million revenue run rate by the fourth quarter in 2024. We're raising $4.5 million for this round. Catapult Crown will be the lead investor, and we're very excited, of course, to work with them. The proceeds will be used, as I mentioned, to do some testing, some product formulation, and some commercialization and marketing. Certainly appreciate the opportunity to speak with all of you. If you would like to learn more, you can join us next Thursday, April 6th at 7 or 9 p.m. Eastern. Thanks, everybody.
Thank you, Greg, for a wonderful closing presentation. Really do appreciate it. Our other presenters may reappear if that would be great. And Trey, I'm going to start with you. I want everybody to unmute. So Benny, you're going to need to unmute, or Jamil, so that way we have, and I'd like, yeah, that would be great. Okay, so Trey, let's start with a few questions. And so I'm just curious. So how many cities are you currently in right now?
So we're in about 10 cities. So it's Houston, Dallas, Austin, San Antonio, Denver, Colorado Springs, Atlanta, Chicago, Orlando, Miami, Phoenix, Los Angeles, and then we're launching New York, DC, and Boston.
And okay, with that, Trey, how long does it routinely take to potentially get to 1,000 to 2,000 dentists in each of those cities?
So we've been improving our growth rate over the years, obviously, as we get better at this and are better funded. So it's kind of hard to answer that question because things change so quickly. But what I can say is that year over year, we've been growing on average about 100% year over year. And so, you know, last year around this time, we were at about 1,800 offices. Now we're at 3,500 offices. And then by the end of this year, we'll probably be at about 6,000 plus offices, maybe closer to 7,000 offices subscribed. So that gives you a kind of a general sense of the rate of growth.
And with that, let me just ask you, total cities, let's say by the end of 2024, with the investment going obviously towards your growth, how many cities would you like to be in by the end of 2024?
In total, we'd like to be in about 20 cities, which is enough to kind of really monopolize all the large metro areas. In my view, this is a zero or hero play where whoever controls the supply and the demand side of the marketplace first wins. There's not going to be kind of an Uber Lyft situation because this product is very sticky from that perspective. So to about 20 cities.
About 20 cities. And at the end of 24, just give me an idea. How many dentists would be your goal to be participating, because that's your SaaS model?
Sure. We'd be aiming for about a wide range, anywhere between 12,000 dental offices up to 20,000 dental offices if we really knock it out of the park.
So if you knock it out of the park, potentially you could have 1 in 9 dentists technically as clients. So I'm going to ask you, how are you going after the DSO market, as that's a growing market?
Sure. I mean, we do a lot of networking with high up executives in the DSOs. Obviously, that's a longer sales cycle for the DSOs.
Of course.
But what a lot of them find appealing is that the entry point is very approachable. We tell them, hey, try us out for 1 location, see how it goes. And then it slowly organically grows into a bigger deal. And so our income stream roughly mirrors the industry demographics currently. So about 15 to 20% of our revenue comes from DSOs and 80% from private practices. So we have great success with both sides of that market.
And I'm curious, okay, we talked about dental hygienists. What about doctors, assistant, and front team members as working with you?
Yeah, so I focus on hygiene just because that's one of the most acute
Right.
pain points right now. So about 50% of our bookings are hygienists, but about 30% of them are dental assistants, and about 20% of them are actually dentists getting booked on the platform. So we have hundreds of dentists getting booked as well.
Okay, I mean, I see that as a huge opportunity along with dental assistants. I mean, I really see the entire profession. Is that how you see it?
That is how I see it. I mean, you look at markets like, Houston, Denver, where we really are dominant, and you can't find staff anyplace else. Like, we ourselves use Indeed to pull staff onto our platform. We will advertise on Indeed, and that's one of our lead funnels. And in emerging markets, we can post an ad on Indeed, reach out to resumes, and get, a decent number of hits to convert. We try that same strategy for ourselves in like Houston or Denver, and we get no results because we've dried up the market. And so the goal is, yes, to replicate that across the entire United States.
Got it. Okay, I'll give you a break. Benny, just a few questions. So let's talk price point of these temporary healing abutments. You said $45. Okay. What's a normal healing abutment go for today? Let's call it. I'm just curious. I mean, this doesn't seem like it is a premium item, but it's not a premium price. Am I missing that?
So maybe I'll have to elaborate. So the $45 is the price for the distributor, and distributors sell that to the dentists approximately between $90 to $100, $110. But if you're considering the the total cost of 1 implant, which range between, I don't know, $1,500 to $5,000, depends on the clinic and, of course, the dentist himself. Adding less than 5% or maybe 3% of that cost and getting a way higher or better process and a faster integration and a better integration, and especially that solution for high-risk patients, that's nothing and very achievable to this process.
No, in no way am I arguing that. I'm gonna take it the other way. Why would an implant company not want? Why would each implant company? Let's just talk about them as the distributor, not like a typical distributor. So, do you see yourself selling to a variety of implant companies and letting them price their own accordingly? Is that how you see the model?
So we're now in the process of, expanding our sales all around the world. We've been we had discussions with the big implant companies, and they all were really interested about the technology. And of course, buying Magdent and, achieving that technology and selling that only with their brand will give them, a huge advantage compared to other implant companies. And currently, this is the Med works with multiple brands, and we want to finish up with all the studies that we have about the periimplantitis. The article will be out probably in the next couple of weeks. The keratin at gingiva, which Professor Shibley is doing the study, will be also out in the next couple of months. And we believe that that will be the new standard of care. I mean, patients, when they have the ability of choosing the normal, healing cap, that they'll have to wait 4 to 6 months, not sure if the implant will be successful or not, and maybe adding $100 or $150 more to this process and achieving better results. We believe that that's going to change the industry and the way that dentists are doing this process.
Okay, I'm going to pose a different question, and then Jamil, if you'd unmute, because you're going to have to participate. I'm going to tell you why I disagree, Benny, but I'm disagreeing to agree on a better way. With implants having all the potential problems that we're learning now 15 and 20 and 25 years later, why would a company really want to sell a traditional healing abutment versus this healing abutment that can, according to Jamil, and please add to this, potentially have better keratinized tissue, better seal, and better integration? You're going to have to explain to me why we would be offering an older type healing abutment versus this is the next standard healing abutment.
Okay, it is a good point, Lou. First of all, because it's a really new brand and new technology, first of all. Second of all, all the development when we're talking about science needs some time to prove all these principles, It's not easy to prove that we are growing keratinized tissue. It's not easy to prove that we are able to kill periodontal pathogenic bacteria, If you took the last 5 to 10 years, we are trying to treat periodontal disease using antibiotics, scaling root planing. So taking all together, if we are able to use the Magdent as a healing cap, not only in the first stages of the osseointegration, but also to recover failed implant, why not? I can do an analogy. It's the same thing that you have an insurance for your health or for your dentistry or for your car. We try to have the insurance to not use. However, if you need, we must use that. If you take all together, including your comments that you agree in part and disagree in part, if you are able to sell all this abutment together with the big brands, and to do that, to show to the patients, not only from the doctors, but also to the patients, that you are able to recover your implant all over the time, this is a really good business. I don't know.
Jamil, I would just say, in looking at this technology, I would be expecting something to be far greater in cost than the traditional healing abutment. That's all I'm going to say. But let me ask you, Benny, and this is not to be critical, but to understand, does the average, and this will be my last question to you, does the average patient get one of these and it lasts 30 days? Do you see the average patient getting 2 of these? Just walk me through that.
Definitely. So each clinic needs 1 activator, but each patient needs 1 med for each implant. So if he have 2 implants, he needs to use 2 meds. Now, as I said before, once the med is being activated, which takes 1 second, it works for 30 consecutive days. The patient don't need to go back to the dentist clinic to do any other procedure. And after 30 days or 60 days, depends if it's on the lower jaw or the upper jaw, The process is done. So he gets back to the clinic and he just take our med out, put the abutment and the artificial crown, and that's it.
So just to conclude this, you're saying 30 days, you should be ready for final impression.
True.
Okay. I mean, okay, I'm good. Now I'm going to go back to Jordan. I know, Jordan, you're not expecting this, but too bad. Unmute yourself.
Sure.
Okay. Jordan, let me ask you this. With this as a clinical dentist, and then I'll get to your colleagues. As a clinical dentist who has hygienists in their practice, with all the carpal tunnel syndrome and all the issues we face with our necks and everything else, how do you see, Greg, by the way, a great presentation, but how do you see the hygienists in general, who are all going to be working for Trey ultimately, how do you see them loving this product?
Listen, I think it's going to be a game changer for the oral hygiene treatment. First of all, there will be less dealing with tartar, and they'll focus more on oral the microbiome dysbiosis. They'll make sure there's no plaque. They'll make sure there's good bacteria in the mouth. The ultimate goal is to make a balanced oral microbiome. And we all know as a dentist that gingivitis is not necessarily caused by tartar, caused by plaque.
Right.
And very often we see patients with gingivitis, but without any tartar. So still the dental hygienist will have a lot of work to do. Also, we have to realize that the future of oral hygiene practice will be into a lot of saliva tests. Also AI, artificial intelligence, utilizing equipment. And so basically tartar is not the only issue of dental hygiene.
I agree. So Greg, if I had to go back to you, you've been in the industry now quite a bit of time. When you look at this, have you seen anything like this being in the industry all these years?
No. And in fact, part of my role at Procter & Gamble when I was there was working on upstream technology and working with the scientists and PhDs who are inventing new technology. And none of them were working on anything like this. And we've done quite extensive patent searches to ensure that there's nobody else that's out there working on it. We've not found anything. So
that's amazing to me. So let me just ask you back to Jordan's comment. I understand the anti-tartar effect. I'm going to ask you one more question after this, but can we talk about the role of plaque? Because that really wasn't, I know plaque is a leading part of tartar. So do you just see this? Because if we're diminishing plaque, which is the #1 cause of perimucositis, which gets back to where Magdent comes in, do you see just a lower plaque incidence down the road for patients with just traditional brushing?
That's an interesting question. Basically, our unique novel compounds target the calcified tartar, and we basically detach it from the teeth. The plaque is, we also have ingredient in our compound, which is antibacterial, and therefore our compound will also fight plaque. Though it's not the major issue of our product, since it has this antibacterial compound within it, it will also fight the plaque. You have to understand the tartar is a complex structure made of organic and inorganic compounds. 70% is inorganic, is basically calcium phosphate, and 30% is organic, which is made of bacteria. Our compounds attack both the inorganic and the organic part. So we do attack also the organic, the oral microbiome there. So we will detach the plaque as well. You answer.
Got it. And let me ask you, so I'll go to Or, and this will be our last question to your group. So Steve, who I know well, asked a question. If this does what it does, Jordan and Greg, but I'm gonna let Or answer this. Do you see patients not needing to go to the dentist as often? Or I'm just asking you that question.
Yes, hello to all. Nice to meet you all, and thanks for joining us. I think that Jordan gave this answer as the hygienist had not checked just the Tartar issue. There is some more issues she needs to check. She is doing the polishing, whitening, checking the gums. So at the end, I still see the patient come to the dentist every 6 months or 1 year, because on the opposite, after the first treatment, which the hygienist will use the tray with the gel, the treatment will be faster, easiest, and they feel much better. No noise, no scratching. So that's we lead the patient to come often, and we not do the opposite fact that you mentioned now.
So thank you. I'm going to say this, with probably more than 1/3 to 40% of the patients in the United States not even going to the dentist, I believe this product could really help the majority of probably a global population who doesn't have that opportunity. And we all understand that opportunity. So kudos to that. One last question, I'm going to say goodnight, but it goes back to Benny. So Steve asked a question, and I think it's a very good question. As implant dentistry modernizes, we use products that have much more of a natural emergence and are more anatomical as healing abutments. We've talked about this, you and me, Benny, or you and I. Do you see the ability to use this med technology in anatomical abutments for temporary abutments?
Yeah, so you know, that's going to be part of the R&D that we're going to do. We have a PCBA battery and a coil, which helps us to generate the pulse electromagnetic field inside the smart abutment, and we just have to change the external part. And so, you know, that will be something that we're going to work with our R&D department.
Right.
And, you know, hopefully we will be able to come up with this product as well in the future.
Thank you so much for that too. Well, I just want to say first off to everybody who got up at 3 o'clock in the morning in Israel and in Europe, I really appreciate your efforts. This will be on Catapult Education site and I think in Catapult Crowns. Investors can obviously go to Catapult Crown. It's easy enough to log in, follow how to invest.